Oops. Heaven, today marks an auspicious occasion. Today is the last Jillian, I was just telling Heaven, but I don't think she's there, that today marks an auspicious occasion.
Oh.
Today is the last
What
lecture.
is the last lecture?
Yep.
I don't know how I feel about that.
Neither do I, because normally it's, it's something I got some wrap. I mean, we still have the test for this unit, which I'll kind of go over Thursday, and then the social media discussion would have been due. I'll give you guys an opportunity to avoid having to write anything by just talking about a story you find tomorrow.
Mm-hmm.
And then that's it for the semester. Kind of
Oh my God.
Kind of an inauspicious ending to.
That's very scary.
So I guess I'll get started and wrap this up. We've talked about the classifications of disorders last week. We talked about some of the treatments, and we kind of got a bit into how do you know if the treatment's working or not. And a non-subjective way to figure out which treatments are best for which disorders is to conduct studies comparing treatments to each other or to placebos like the sugar pill. Though you can probably imagine that the therapy equivalent of sugar pill might be a little bit more complicated. These kinds of studies have shown that for depression and panic disorders, for example, cognitive therapy is most effective, potentially because these disorders are in part caused by the kind of negative thinking directly addressed by cognitive therapy. For obsessive compulsive disorder, behavioral therapy and medication work the best to combat the compulsive behaviors and the anxiety that characterize these disorders. For specific phobias, systematic desensitization really does help patients face their fears. Studies also isolated certain characteristics of the patient and the therapist that affect how well any of these treatments will work. The patients most likely to get better tend to be motivated to improve and have personalities that lead them to attack problems actively. They're also likely to have strong support from family and friends. The patients least likely to get better tend to think negatively and behave hostilely. And for reasons therapists don't thoroughly understand, personality disorders and psychotic disorders like schizophrenia tend to have lower rates of recovery in general. But regardless of the strategy they use, therapists who are warm and empathetic tend to have the highest rates of success with their patients. On the other hand, therapists who behave inappropriately can hinder therapeutic process or even do more harm than good. Therapists who act with prejudice or without understanding of cultural differences between them and their patients can end up making the patient distrustful of the therapist and of therapy in general. And those who, in a Freudian model, try to produce false memories of past trauma, which was a huge deal in the 1980s. There was a slew of court cases brought against men from people who said that these men had abused them as child. And we're talking 20 or 30 years in the past. And how do they know this? Why didn't they come forward? Well, this was only brought forward recently because of therapy and repressed memories. And so it became kind of like a witch hunt that anybody could be accused of this because of this accepted science. And it can end up setting a patient back in recovery, actually. And finally, it should be obvious that a sexual relationship between a patient and therapist could be harmful to recovery. Still, it happens. There's the term I think we kind of talked about, transference, that the therapist kind of becomes a replacement for a loving partner who, in their mind, a loving partner is someone who would listen to their concerns and talk about them and show care for them. And so they transfer the feelings of loving partner onto the therapist. And, even for the therapist, transference to the patient can happen. And these things happen and is a serious ethical violation, though. So therapy can only be effective if patients participate. And many feel that there's a stigma associated with people who see therapists, or that therapy is just too expensive. In general, women are more likely to seek help than men. Cultural differences may lead some people to seek more informal advice from friends and family than to see a therapist. In the case of a disorder like schizophrenia, which usually requires medication to successfully manage, cultural barriers can be disruptive to therapy as well. Additionally, for other disorders, informal support networks may work well. Now, a lot of people who probably would benefit from seeing a therapist instead engage in self-medication, drug abuse, alcohol abuse. And if you've ever wondered why your body seems to relax after having a few drinks, hopefully you might not have had this experience yet. I don't mean to, I'm not judging you if you have, because I did at your age, but maybe you've wondered why people pass out after a heavy night of drinking. It's because alcohol is a depressant. And excuse me, some depressants like alcohol are used recreationally by people who want to relax. So while depressants can be used safely, they're dangerous if used inappropriately, and many are available only by prescription or even illegal. So what exactly are depressants? At the root of the word depressant, obviously, is the word depress. And when we're talking about drugs, this doesn't mean to feel sad or down. Instead, depress means to reduce your level of activity. And this is exactly what a depressant does. If you try walking when you're drunk, it's, your coordination is going to be depressed. Your ability to think is going to be depressed. Depressants are drugs that slow down the activity of the central nervous system. And by decreasing the electrical activity in the brain, depressants produce a calming effect in the body and slow down the brain's normal functioning. And depressants can decrease your level of awareness, hence why you're not supposed to drive when you're drunk. They can lower your pulse and heart rate and reduce breathing. For these reasons, depressants are also referred to as downers. Depressants can cause relaxation and calmness in smaller doses, which can result in reduction in anxiety, lower inhibitions. If you've probably heard stories of people who are drunk coming out and saying things they wouldn't normally say or doing things they wouldn't normally do. Depressants taken in larger doses have some pretty serious consequences, though, including complete loss of consciousness, passed out drunk, loss of senses, slurred speech. Hey, man, I love you. You're like my best friend. Respiratory depression, even death. So you've probably used depressants in the past, maybe without even realizing it. For example, if you've ever had a prescription for insomnia or anxiety, you've likely used a depressant. And because of their calming properties, doctors prescribe depressants to treat anxiety and sleep disorders. Depressants are useful for treating seizure disorders because they reduce the electrical activity in the brain. I know my son takes a drug called clonazepam, and he just passes out. He's just groggy. At higher doses, depressants can be used as general anesthetics as well. I mean, you've probably seen some old cowboy movie where, the guy gets shot or bit by a rattlesnake or something, and they have to, amputate his leg or something so they get him drunk. So let's look at some of the more common types of depressant drugs, including barbiturates, benzodiazepines, ethanol, opioids, cannabis, and flunitrazepam. Let's start with barbiturates. Barbiturates are created from barbituric acid. And barbiturates have sedative and hypnotic properties, which means they reduce anxiety and they induce sleep. Some common barbiturates: luminol, phenobarbital, it used to be called, it's kind of a generic name for it. It's used to prevent seizures. Amytal sodium or amobarbital, used to treat sleep problems. Seconal or secobarbital, it's a short-term treatment for insomnia. The second category of depressants, benzodiazepines, you've probably heard these on commercials. They're always, if you're taking a sedative or a benzodiazepine, please consult your physician before taking this drug. So like barbiturates, benzodiazepines have both sedative and hypnotic properties. They also decrease muscle tone. You may have seen commercials for common benzodiazepines like Xanax. Some common benzodiazepines, I just mentioned Xanax, alprazolam. It's used to treat anxiety and panic disorder. Valium, I'm sure you've heard of, diazepam, used to treat anxiety and panic disorder, seizures, and muscle spasms. Matter of fact, my son, it does take diazepam. Klonopin, he also takes clonazepam. It's used to prevent seizures. 3, ethanol. And you've probably heard of ethanol. It's what you mix fuel and corn to put in your car, right? But it's also the generic term for alcohol. So chances are that you're familiar with the effects of alcohol. Just a few drinks, alcohol reduces inhibition, impairs judgment, and impairs coordination. After a lot of drinks, alcohol can lead to loss of memory, loss of consciousness, and even death. And the effects of alcohol are dependent on the amount of alcohol that is present in the bloodstream. And this is known as your blood alcohol content, or BAC. And so the more alcohol you have present in your blood, the more dangerous the effects and the more strongly it reduces the electrical activity in your brain. The fourth category, opioids, you're probably familiar with because the United States is currently undergoing an opioid crisis. According to the media, that's what they're referring to it as, that a lot of people in the United States are now addicted to opioids. And if you've ever been prescribed pain medication after surgery, you have been prescribed an opioid. Opioids are drugs that bind to opioid receptors, which block the perception of pain. In other words, your nerve sends a signal to certain receptors that will pick that up as pain, and they're being blocked, so your brain's not registering any pain. And these receptors can be found in the brain, spinal cord, even in your gastrointestinal tract. Some commonly prescribed opioid pain relievers are codeine, morphine, oxycodone. Heroin, which is a highly addictive illegal street drug, is also an opioid. And heroin causes a strong rush of euphoria shortly after it's used. Lastly, cannabis, or I shouldn't say lastly, but fifth, cannabis is created from the cannabis plant, also known as marijuana or hash. It can cause confusion, memory loss, feelings of euphoria. Cannabis can also slow your reaction time and increase pulse, heart rate, and appetite. I'm sure you've heard of people high on marijuana who get the munchies. At higher doses, cannabis can cause hallucinations, delusions, disorientation, decreased consciousness. And finally, flunitrazepam. If you've ever been warned to watch out for predators who put date rapes in drinks, then you're probably already familiar with the effects of flunitrazepam. Flunitrazepam is an illegal drug in the United States, actually. It's also referred to as Rohypnol. It's a very powerful sedative that can last for several hours. Rohypnol can also cause temporary memory loss and problems with the stomach. Rohypnol can make its user completely unresponsive and has been used on victims of sexual assault. And this is why Rohypnol has been referred to as the date rape drug. So some important facts about all these categories of depressants. All depressants have the potential for abuse. And people who use depressants over a long period of time develop tolerance, which means they'll have to take increasingly larger amounts of the drugs to get the same effects. Withdrawal symptoms may also occur after people stop taking the depressants, and sometimes these withdrawal symptoms can be so severe that they can even cause death. Multiple depressants should never be combined, hence all the warnings at the end of these drug commercials. Doing so will multiply the effects of the drugs, which increases the risk of overdosing and death. And believe it or not, that's it for the semester. Do you guys have any questions or comments?
Nope. That makes me feel weird though.
I agree, me also. We do have a couple more meetings this week. Yeah, like I said, tomorrow, if you want to get the grade for the social media thing, come with a story. We'll discuss it. And I'll, share it with me. I'll post it on Remind for people to respond to. Hopefully some people will want to get that grade because it's actually 15% of your grade. So it's a huge chunk just to write something and say something. And then Thursday, we'll go over what I would have done for this unit's exam, which is actually pretty simple. So wanted to keep it simple because it was the last thing and it was a time crunch on the schedule anyway, getting near the end. So that's all we'll do the rest of this week, and then we're done for the semester after that. You look sick, Heaven. Are you all right?
Yeah. Can you even hear me?
Yeah.
Oh, okay. Well, I was
You're
talking
real soft, but
I was talking earlier and you said you didn't hear me, so
no, I didn't hear you earlier. I wasn't even sure if you were on there. So
I didn't know if it was just not working. No, I started back at McDonald's yesterday. So I had to be up at 4:00 yesterday morning.
Oh, wow. Okay. Well, I'll let you go and let you get some sleep, hopefully.
Well, I can't sleep actually because I have to work this afternoon.
We could always take a nap beforehand.
Yeah, it's just yesterday was kind of a rough day because I found out some stuff about Angel and it kind of just all went
Oh,
downhill.
shit.
Yeah. Well, she's 5 months pregnant.
Who is?
Angel, my sister,
Oh.
and
She's married, though, right?
No.
Not that it matters, but oh, okay.
But her boyfriend's wanted in like a crap ton of counties, and it's just really complicated. And she called.
Oh, I'm sorry to hear that.
Okay. And she called yesterday because she calls when she needs something. And so it all just kind of went downhill yesterday when I got home. So I'm just tired and worn out.
I'm sorry.
It's okay. And so I have to work this afternoon, and I have a basketball banquet, and I'm just getting.
Yeah, that's at 11, right?
Yeah.
Today?
Yeah.
Yeah, I don't have that shirt we're supposed to wear either, so.
I didn't even know. I don't even know what's going on, if I'm being honest. No one told me anything, so.
Okay, you're supposed to wear your black basketball camp shirt, but I don't know where that is. So if you can't find it like me, just wear a black t-shirt.
Okay.
And that's today at 11. I better let you guys go then.
No, yeah, maybe.
All right, you guys have a good day.
You too. Bye.
Bye.